The health and well-being of women are crucial for the development of any society. And according to research, Nigerian women have myriad of health challenges. And some of these health challenges, if caught on time, can either be treated or avoided successfully. A very beautiful evening to you, and thank you for joining me on a very special edition of Ghana Plus right on Afia TV. This is where we talk about health issues that affect women and girls in the society. My name is Doris Mayam Shishe, and of course this program comes up every Wednesday at 6 p.m. and there's always a repeat broadcast on Saturday at 8 p.m. And remember, Saturday is a very special edition, as you would notice the scenery, the beautiful background. Oh yes, your guess is as right as mine. And of course, just to, celebrate Nigeria at 6 to 4, we decided to do something very unique. We spoke to some women who probably would have one or two issues or know what issues women go through as it concerns their health. And later on in the show, my beautiful guest, who is beautiful seated here, would talk about these issues, bring some perspective to these issues, and of course, you get to learn more as usual. But hey, that will be after the break. Please stay tuned. Welcome back. If you just joined us, you're watching Ghana Plus right here on Afia TV. This is where we talk about health issues that affect women and girls in the society. And of course, I am Doris Mayum Shishe. And like I said before, this is a very special edition. Nigeria recently marked its 64th independence anniversary. And as patriotic citizens, you would have noticed my outfit. And of course, that of my beautiful guest, Dr. Brenda, who will be joining me to talk about some of these issues today. Dr. Brenda, it's good to have you.
Thank you, Doris.
Happy Independence Anniversary.
Thank you.
I remember when we did this last year.
Yes.
And you looked like I had my headpiece, but I don't know, maybe I forgot today.
No, today I just said let me just go and represent the team. Let's bring a little bit of Benway into anything today.
You're actually Benway. How can you be Igbo? But it's fine. Patriotism we're talking about.
Patriotism, because the health challenge is cuts across tribes.
It
so I mean, you just as well represent, every tribe in Nigeria.
Now, good enough. We did something, because to commemorate this day, I mean, it was yesterday actually, and one would only think that why are we talking about these things? It's something that cuts across, but when it comes to health, but women in this context, because that's what Ghana Plus is about. Before we even talk about some of these issues, why do you think it's important that we talk about health issues that women go through on a day like this?
Okay. It's important to talk about the health challenge because even let's look at the population of female in the whole world. It's about 3.9 billion. So imagine that amount of people. You can't just relegate them to one side. It's important that you talk about their health because, as I say, health is wealth. So when they're healthy, they can be productive citizens, right? And if you bring it to Nigeria, do you understand, being like the most populous, country in Africa, female occupy 49.95% of that population. Do you understand? So I think it's imperative that we do talk about the health challenges women face because there are quite a number of issues that, women have to deal with on the daily. So I think bringing it to the forefront to discuss it and talk about the way forward will really be something that will be beneficial to my gender and to the community at large.
Because if it benefits the women, it benefits the society.
True, definitely.
That is, no-brainer.
Definitely.
Now, we've talked about series of health issues that affect women on Ghana Plus. That is something that sometimes we feel is necessary for us to talk about. But this time around, we did something different. We spoke to some women, and some randomly mentioned some issues that they feel women go through. And these are some of the issues that we've even talked about on Ghana Plus. And for instance, one of the ladies talked about painful menstruation. And it seems like people don't pay attention to these issues. And most times, some men who probably have less information will tell you, it's just menses now. So why is she acting like her life is ending? So but we'll take a moment and then listen to that clip and maybe Dr. Brenda will react on it.
My name is Okwiko Gechuku. Anyway, what are the things I see where women facing now is menstruation pains. It's always giving them headache, having pains all around. They'll be taking like pills, drugs, and everything. At the end of everything, it will not stop. So I don't really know what is causing all these things.
The thing is, it's not far from what we've been talking about. Just like the young lady there has really mentioned that painful menstruation is one of the things that women go through. I know during the World Menstrual Hygiene Day, we did something really special. We visited a school, that's the Lady Biam Girls Secondary School, and we talked about menstruation holistically. So now it seems like, okay, we decided to catch these girls young, but it doesn't seem like this information cut across board. Just give us some perspective to this.
So I would say in terms of menstrual pain, because menses is something every female would experience. It's a physiologic event that's going to occur every month, right? And now for some people it's painful, for some people it's painless. Now let's focus on the painful aspect of it, right? And now we can call it menstrual cramps, menstrual pain. You know, the medical term is dysmenorrhea, right? Now under dysmenorrhea we have two types. It can either be primary or secondary, yes. And under the primary dysmenorrhea, right, the pain is not related to any of the pelvic organs. So it's not related to the ovaries, to the fallopian tube, or to the uterus. But for the secondary, the pain is usually related to an issue that has to do with the ovaries, right, fallopian tube, or the uterus. So now the most common one most likely will be the primary, you know, dysmenorrhea. And this pain usually will occur some days before. So even the pattern which the pain occurs can even give you a guide. So I would advise women, don't be quick to dismiss painful menstruation. I know sometimes people just say, it's expected. But when it's really affecting your life, your lifestyle in general, you can't do anything, you're not productive, I think you should really seek the help of a physician. But let me just quickly explain. So with primary dysmenorrhea, right, what actually happens is that the pain is caused from contraction of the uterus, because now, you know, menses is the inner lining of the uterus that is shedding off because the uterus has prepared to receive a baby, right? So now when the egg is not fertilized, it has to shed off. So when it's contracting, right, prostaglandin is released, and when it's released, it's causing that contraction, which causes the pain. And also, you also notice that there's pain with people, like when they're passing little clots of blood. So let's say now this is the cervix trying to come out. So the little is like a force is trying to pass through here. So there's pain that will occur. And now if you notice, you hear some females say, oh, they usually have back pain. So the back pain is just what we refer to as referred pain. Yeah, so it's not, so the pain is still originating from within the uterine wall, but it's referred to the back because they share the same nerve root. So that's what they just called referred pain.
Okay, so very quickly, before we even move on to the next video, what happens when this pain is, more like what home remedies can
one do
to manage the pain before we see, you mentioned that.
Yes.
It gets to a point you should see a doctor. So what should be done to...
I think, one, you can grade your pain. If it's something that is mild and it's just, you probably can. Some people actually, the position they take, there's a way you can lie down on your tummy. It actually helps to relieve the pain. Some people can just apply one bottle of water on their tummy. It helps to relieve the pain as well. But you can take medications like paracetamol. It helps with the pain for those who
severe. I've heard, sorry to really interject.
No problem.
I know I've heard people will tell you, no doubt, the moment you take paracetamol, it affects your fertility level. Randomly, I've heard this kind of, it's a good thing that you mentioned that one can actually take it.
No, one can actually take it, but then again, most people will take the NSAIDs, right? But then we will not, for you to take the NSAID, you also have to make sure you don't have gastritis, you don't have peptic ulcer, you don't react to the drug. So there are a lot of criteria you must check before you say, okay, let you just go and pop your NSAIDs, right? But I would just say, when we do this kind of discussion, is for you to get informed so that when you go see your doctor, you know the right questions to ask. So even if when you come to our consulting room and we're like, it's just, no, if it's really painful on a scale of maybe 8/10, I think you should really emphasize the severity of your pain so that we can actually do more investigation. Because in all honesty, you know when I said the secondary type, sometimes now if you have endometriosis, which we talked about on this channel, yes, if you have fibroid associated with it, sometimes this can lead to an increased severe pain, even when you have fibroid as well. So, but you can only detect that by doing further investigations like ultrasound and all that. So you can help detect and know, okay, is this just the primary we're dealing with or the secondary? Because the treatment also will be dependent on the cause. So in some cases, let's say it's fibroid, you have to probably do surgery. If it's endometriosis, you also have to do surgery as well. Do you understand? So knowing the cause will really help to alleviate the symptoms later on.
All right, see, it's a good thing that Brenda has talked about this. So if you're just tuning in for the first time, this is Ghana Plus, where we talk about health issues that affect women and girls in the society. And yet the discussion of menstruation is not particularly new on this show, but because a woman talked about it and you want to learn more, you can go to our YouTube channel, Afia Culture and Lifestyle, on YouTube, of course, so you can catch up with all of the details and information. So at this point, we'll take a very short break, and once we return, we will talk about some of these other issues that were highlighted by these women. Please stay tuned. Welcome back. If you just joined us, you're watching Ghana Plus right on Afia TV. This is where we talk about health issues that affect women and girls in the society. And of course, my name is Doris Mayim Shishe, and I still have my beautiful Dr. Brenda right here in the studio. And in the spirit of Nigeria at 64, you can see the attire. Patriotic citizen. Now we've seen the first clip. The woman talked about painful menstruation, which you rightly addressed. And in the course of the explanation, you mentioned something which is fibroid.
Yes.
And thankfully, the second video is about fibroid. Take a moment, and then we listen to that.
All right, my name is Hope Jonathan, and I would like to talk about the fibroid. The youngest of the generation are suffering from fibroid, and I don't know the cause of it. It's no longer about the age, even the ones at adolescent age, the young adults, the adults. I don't actually know the cause of it, and I think there should be more enlightenment so that people will know the cause of it and avoid anything that will bring it to, because it's a serious issue now.
Okay, now she has highlighted some of the issues. Perhaps you could see her concern was that she probably doesn't know what is responsible for this. And then women, young and old, keep getting down with the diagnosis of fibroid. But good enough, you're here again. And yes, coincidentally, we talked about fibroid on the show.
Yes.
But I mean, briefly bring some light to this.
Okay, so fibroid is something that is very common in our society. And it's common because one of the risk factors is our race, being black. So yes, the prevalence is more within the black community, right? You know, she'll say something in terms of like, what's the cause and all that. There's actually no cause, right? But we do associate it with increased level of estrogen and progesterone, right? But now let's look at the risk factors. So I've talked about race. Early menarche, so when a girl starts her menstrual flow on time, can predispose to that. Obesity, yes, also predisposes one to fibroid. Then also if there's a family history of fibroid, most likely, you know, some other people get it. But the thing about it is that most of the time, fibroid is asymptomatic. A couple of times, the girls will go on like as if nothing is happening. Then usually the first time will be maybe she has a very heavy flu. That's when she'll be like, okay, this is a bit. So in the process of, some people also find it on routine ultrasound and they pick it up. Do you get? Especially maybe when they take in and they want to go for their, antenatal care. So some people pick it up, yes. Some people just pick it up based on maybe a complaint about another symptom and they scan and be like, oh, there's a fibroid. But for most females, it doesn't cause any, dilapidating symptoms. But when it starts being symptomatic, you really need to seek help because most likely they have to go out and remove the fibroid. So. Yes.
I like the fact that Dr. Brenda is, there's this emotion around her face. See, we've talked about fibroid before on the show. And if you're just tuning in so you don't get confused, what we are doing today is basically a highlight of some of the health issues that some Nigerian women are maybe experiencing or may have experienced. And this is coming on the backdrop of some of the vox pop we did. We went to the street, spoke to some women, and these are their issues that they raise. And Dr. Brenda is bringing some perspective to these issues. And now she's talked about fibroid, and I'll refer you again to our YouTube channel, Afia Culture and Lifestyle. There's a part 1 and part 2 of this conversation there, so you can get all of this. Like one of our ladies said, these are some of the issues that are quite common among Nigerian women. And very quickly, we'll watch the third one again, and then we talk about it. Let's take a look.
My name is Nina, and I want to talk about some sicknesses that women go through that should be created more awareness on. Today, I want to specifically talk about Pcos, also known as Pcos. So I think that this should be created more awareness on so that women who are going through it would know how to manage themselves. Thank you.
Okay. She talked about PCOS.
Yes.
For her, she doesn't understand why there's no awareness around it. So she feels like there has to be adequate awareness around polycystic ovarian syndrome.
Funny though, it's a beautiful thing we're talking about this because all these we've highlighted are quite common, although we still probably just touch on some other common ones. But PCOS, polycystic ovarian syndrome, is when the ovaries are producing in excess, right? And they produce the hormone we call androgen. So when they produce the type of hormones, that's that's what gives you all the symptoms you see when they start having like, most women would tell when they start having reduced menstrual flow, their menstrual flow becomes scanty. Sometimes they won't even see it at all. That's why, okay, they become concerned. Then sometimes they see masculine hair distribution. So sometimes they have facial hair, you know, rising above their pubic symphysis and all that. So when they start seeing those kind of changes, that's when, okay, they get concerned. Sometimes also affect their weight. So most of the time they put on excessive weight. They try to lose it, it's not coming off. You get, in some cases, they won't even ovulate at all. So it leads to infertility, sorry. So if you notice, most of the time when people are trying to look for children, that is when they are now, yes, that's when they realize, oh, I have PCOS. So it's not something they pick up ordinarily.
But well, as much as I don't want to expand this, because we talked about PCOS.
Yes, we talked about
I think that was about a year ago.
Yes.
As much as I don't want to really, you know, want you to expand on this. Is this something that's hereditary? Is it something that is there some sort of way that the hormones can be balanced later on, so it becomes a bit feminine?
No, I think in terms of management, what your basic guys is the management, right? So in terms of the management, we're based on your symptoms, right? That is how. So based on your symptoms and your desire to have children, so that will determine how they manage you. Like I said, most of the time people find out that, oh, when they want to have a child, that's when they realize, oh, I actually have this. So now there's some medications the doctor will place you on to try to see how much they can regulate those hormones and all that, so that you can be able to conceive and have your normal family. So the good thing about, I just want to tell people this. You've seen this thing we talked about, PCOS, the fibroid, the menstrual. You're not alone. It's something that a lot of women experience. So if you know that a lot of women experience this and they've overcome it, it's left for you to know that whatever issue or health challenge you're having, is something that can still be done about it. So it's not like, oh, okay.
It's not a dead sentence.
Yes, it's not. Don't feel like you're left alone. A lot of women go through this. Even us within the medical space, let's just be real. A lot of us go through similar issues, but it's just that there are measures in place to be able to say, okay, we can tackle this, and take care of the respective symptoms you're having and give you a beautiful outcome that you desire.
Now, I like the encouragement from Dr. Brenda. This whole Nigeria 64 thing is, you know,
you need to have positive energy. It's independence. You have to have positive energy.
No, but seriously, so this is not a dead sentence. So you need to talk to someone. That's the essence of what she said so far. Now, as we try to wrap up this, right? I know it doesn't just end with the three issues that have been highlighted. When we're speaking to three women, it doesn't make up the population.
Yes.
You quoted the statistics earlier on, and there are quite other issues, a number of other issues that are out there. Just briefly do a rundown, maybe top five.
Okay.
Top five.
So I just want to break it down into like social issues, and because funny, some of the social affect the main health, medical issues. I'm just going to say social and medical, right? So under the social issue, one of the major challenges or issues women face is poor education. So with poor education, you probably won't have a good job before you know it. You're not economic empowered to be able to even afford the medication that you need.
And depression comes.
Do you understand? The depression comes in because if Augusta is not going to give you money to treat yourself, you're just there looking at yourself. You cannot come to the hospital to even meet us, to even find out what the main cause of your problem is. That is one. So poor education. The second would be gender-based violence. So, you know, women are the vulnerable group. So most of the time, the incident of sexual abuse, physical abuse, emotional abuse is most likely, yes, the male still experience it, but we do know the percentage is way, way higher among the female gender. So once a woman has been abused, there are issues relating to that, right? Because she can get an STD from that sexual abuse, which can even cause, part of even the cause of that dysmenorrhea, painful menstruation, is PID. Pelvic inflammatory disease, which comes from STD. So you can see how all these things are intertwined. You get then also harmful cultural practices, like the female gender which you talked about, the breast ironing we talked about. Do you understand? Yes. So you can see how the social issues now will enter into the health issues. Like even the social issues when they do early child marriage, right? Because now under the medical, one of the top health challenges we have as women is maternal mortality. And early marriage can also predispose you to that. Do you get? So for the medical, we have maternal mortality. We also have breast cancer, cervical cancer. Do you get? We have things like PCOS and all of that. So so I just wanted to group it into those so that we know that whatever we do as a community affects the health of a female indirectly. So now, if we want to say, okay, how do we right the wrongs? I feel you need to get women into the rooms where decisions are made about their health. You cannot have a committee or a panel filled with men making decisions about women's health because you cannot understand fully what they go through. So I think women should be involved in making such policies that govern their health, and more funding should be put into the health sector in general. I'm not even going to make it a female or a male issue. I just think the health sector can do much better than its current state now. So as we are celebrating this independence, I really pray the health sector can be truly independent on its own.
Yes, I mean, Dr. Brenda has said it all. So they don't be asking you, how can women be proactive about their health? Because I know that you've said it all. Once you see that something is wrong with your body, go see a doctor, talk to medical experts so that you don't take these things into your hands. It's been a wonderful time on this special edition. And as you can see, the beautiful scenery, more like. Honestly, all of these clips are available on our YouTube channel. She talked about maternal mortality. We've handled that on the show. She talked about issues on PCOS. We handled that on the show. And then she mentioned quite other issues. The cervical cancer that she mentioned, and breast cancer, breast ironing. All of that has been talked about on Ghana Plus. So do well to visit our channel, subscribe, so you get to watch all of these clips. So you learn every day, because I mean, knowledge is power, and the only way we can get all of that power is if you keep learning. It's been Dr. Brenda on the show. Thank you so much. And yes, it's a special outing to, further, as patriotic citizens that we are, further celebrate Nigeria on its 64th independence anniversary. And that's where we call it a wrap today. Thank you so much for watching. I am Doris Mayim Shishe. Do have a lovely evening and keep enjoying the rest of your day.